Hi, my name is Amy Joyce, and I'm the Director of the Office of Child Care within the Early Learning Division of the Oregon Department of Education. On August 14th, we issued new guidance for operating child care and other early education programs during COVID times. We're doing a series of videos to help you understand and implement the new guidance. Please start by watching the introduction video from ELD Director Miriam Calderon. The introduction video describes the purposes of the guidance and the process we use to develop it. Then watch the overview video, which describes who the guidance applies to and the process you need to follow to legally operate. For example, we continue to operate under the Emergency Child Care or ECC system, requiring licensed child care providers and others to apply and be approved to operate as an ECC. This video covers stable group size. This is section 5 of the new guidance, and you'll find it on pages 25 to 29. The focus of this section is limiting contact among people in childcare to limit the spread of COVID in case someone contracts the disease. Physical distancing is a key strategy to reducing the spread of the virus, but we all know that in childcare, keeping 6 feet apart is challenging at best, and with very young kids, it's essentially impossible. Because of that, the guidance directs several other methods to reduce the spread. Keeping groups stable helps with that. The other focus of the section is the size of the group. This is one of the biggest changes in this new guidance. It recognizes the needs of families to have access to care and for child care providers to have a financially viable business. The increase in group size is offset by additional measures like facial coverings to reduce risk. Okay, let's talk about the stable part of stable group size. Stable group means you assign and keep children in the same consistent groups with the same assigned adults. A new child can be added or moved to a different stable group if it's a permanent change. Only staff assigned to a stable group may be inside the classroom, with the following exceptions. Some additional adults from outside the stable group are allowed into the classroom, like specialized services to children, such as those associated with early intervention or early childhood special education. Additional adults to meet monitoring requirements of publicly funded and regulated programming. Additional adults to maintain ratios during staff breaks, including floaters. And additional adults who are providing service to the facility that cannot take place outside of program hours. In addition, require staff to practice 6-foot physical distancing with other adults in the facility. Require staff to practice physical distancing with children from other stable groups, and to take precautions to ensure that children do the same. Staff and children who are not required to physically distance from adults and children within their own stable group. When outdoors, there can be only one stable group in an outside area at a time. Programs can have separate areas as long as the stable groups are kept apart. Remember, outdoor areas need to have at least 75 square feet per child in that area. You can use a visual barrier if you'd like, rather than a physical barrier, to separate the two outdoor areas. This helps children understand which area is theirs. Now we'll turn to the size part of stable group size. To start, you cannot go over the number of children or the staff to child ratios allowed in licensing rules and your specific license. For example, some providers have a license that limits their numbers below the maximum allowed in rules, usually due to square footage limitations. Nothing in this guidance allows you to go over your license limit. Also, no facility may serve more than 250 children. Now, this is only relevant in the largest centers and recorded programs. And this maximum capacity is the same as many other sectors under their guidance from the Oregon Health Authority. There's a key change from the draft guidance that we put out in July. The group size you can have is now tied to the county you are in and the county's phase of reopening. I'll get into details in a minute, but here's the summary. If your county is in phase 1 or phase 2, you're returning to normal group size with one exception. Centers and larger recorded programs can have only 20 school-age children per stable group, not 30. Also, if you are in a baseline county, meaning the county is in a stay-home scenario, you are limited to stable groups of 10. But know this, as of August 21st, none of Oregon's counties are in baseline. You can find a map and a list of counties and their phases on the internet. The link is in the guidance document, or you can just use your internet browser and search Oregon County Phase Map. That map is up on the screen now. So take a look. Okay, before we go through group size by provider type, I want to share one way that we describe the stable group size. For those of you who have been operating in ECC already, this is the team concept. So providers are allowed a number of kids within a stable group. That number is more than the number of kids that can be in the classroom at one time. To help describe this, we use a sports analogy. We sometimes refer to a stable group as the team, and the number of kids on site that day as those on the field. So on a sports team, you might have 12 kids on the team, but only 10 can be on the field at one time. It's the same with these stable group numbers. A provider can have a certain number of kids on the stable group team, but only a portion of those kids can be on site at one time. Basically, this allows for part-time care with kids sharing one slot. All right, let's go through this by provider type and specific numbers. Remember, this is only an overview. Look to the guidance document itself. It includes ratio tables and other specific information that you will need to know. And as I said before, the maximums in these guidelines do not override any limit on your underlying license. If you're a registered family provider, you can have one stable group with 10 children on site. 12 children can be enrolled in the stable group or on the team, but again, only 10 on site at the same time. Certified families have a couple of options. Again, this is in phase 1 or 2 counties. If you're in baseline, you're limited to stable groups of 10. But in phase 1 or 2 counties, here are your options. You could have one stable group, 16 children on site at one time, and 20 children in your stable group or on your team. Again, the number of kids allowed on site at one time might be less than 16 depending on age groups or your underlying license. Check your ratio tables. Your other option in a certified family home is to have 2 stable groups in different classrooms or rooms of the house. If this is your choice, you can have up to 10 children in a classroom at the same time. They each need to be separated stable groups, and each of them can have 12 children enrolled or on the team. As always in a certified family home, you can have no more than 16 total children on site at the same time. For the 2-group option, there needs to be a physical barrier between the groups. Now this could be a door, or you could put up a barrier between the 2 rooms. If you use a barrier, it needs to be at least 4 feet high, and it needs to be strong enough so that kids can't go over it or through it. And get that barrier approved by your licensing specialist. In certified centers and larger recorded programs and in schools, in phase 1 or 2 counties, you'll follow your standard ratio tables with one exception. Your limit of school-age children is 20 rather than 30. These programs, in classrooms serving kids up to age kindergarten, can have 4 additional children enrolled in the stable group or on the team. Again, in phase 1 or 2 counties, you can have no additional team members in your school-age stable groups. In a baseline county, these programs can have up to 4 additional school agers on the team, where again in baseline, you're limited to 10 kids on site. The basic idea here is to limit the overall exposure for kids and adults. In gyms and cafeterias and other similar very large spaces, those are limited to a single group of 20 or split into 2 groups. Those very large rooms cannot be split into more than one classroom for multiple groups of 20. We expect you already have questions. We're trying to anticipate those and provide some answers. So, question. If my program has an exception for group size, is it still valid? The answer is exceptions for group size that go over the limits in the guidance are not valid. Question. Will Office of Child Care be granting group size exceptions? No, we do not expect to issue exceptions to group size limits in this guidance. However, if you have a truly extraordinary situation, talk to your licensing specialist and we can look at it. Question. Can stable groups be combined at the beginning or the end of the day? No, except for siblings, because they are with each other at home. Otherwise, the stability of the groups needs to be maintained. This really is the key to reducing the chance of spreading the virus. Question. What if I have the maximum number of children allowed and then my county goes back to baseline? Will I need to remove kids and families from my program to return to the baseline maximum of 10? We're working on an answer to that question. At the bare minimum, there would be a grace period, which we will announce for everyone, that would apply to any county that returns to baseline. If you have questions, please email them to providercontact@state.or.us. That's providercontact@state.or.us. We have an FAQ section on our website, and we're always updating that with your questions and our answers. So finally, what resources or supports will the Office of Child Care be providing? We'll be updating that stable group size graphic to try to help you understand stable group size. If you have ideas for other resources, please send them to that provider email address and we will consider them. Thanks for watching. And thank you for providing nurturing care and education to children. This is such a crucial resource for Oregon's working families. Thank you.